Community Connections, airing on OROMIA11. I am your host, Anna Orr, and today's guest is very special to our organization. She is here to talk about aging, open enrollment, and how you can better take care if you are a personal care attendant or someone that is seeking resources for the senior citizen in your life. This is going to be a wonderful episode full of some resources and hopefully some viable connections you won't want to miss. Good morning. I'm so excited to have you joining me.
Thank you.
Can you please introduce yourself to our viewers and talk about your organization?
Sure. My name is Jetta. I am with an organization called Trellis. We are the area agency on aging for the state of Minnesota, focused on the Twin Cities area. So we are an organization that assists individuals to age successfully and to develop the capacity of communities to care for an aging population. So our whole emphasis of what we do is to help people optimize well-being as they age.
That's really important. Can you kind of talk to us about the Senior Linkage line and some of the work that takes place around that resource?
Sure. The Senior Linkage line is a free statewide service of the Minnesota Board on Aging. They work in partnership with my organization, Trellis, and the other area agencies on aging. So, for instance, we are a statewide resource and referral for individuals who call. So we might have individuals call. It's a toll-free helpline from Monday through Friday, 8 to 4:30. We might have older individuals call for services for themselves, or they might want to make applications for a service. We might have family members. I've made my brother call on behalf of my grandparent, because I work on the Senior Linkage line, and I wanted him to experience it. So he called in to find housing options for my grandparents. But we might also have professionals, individuals who work in senior centers or adult daycare centers that love and work with seniors. We might have those individuals call and ask for resources to try to figure out what we could do, because the Senior Linkage line has over 60,000 points of data in the system statewide, from Ely all the way down to Rochester, from east to west. And it's just an opportunity for the state of Minnesota to provide resources for families, because we don't typically know what's out there, when we get older and technology is not with us and we just don't know what resources are available. This Senior Linkage line is kind of a bridge between families and caregivers and the professionals to the resources out in our neighborhoods.
That's important. Now, you talked a little bit about having your family member call the line for
Yep.
support with your grandparents. Can you talk about your professional background and how you personally connect to this work?
Sure. I have always worked, for the most of my career, I've worked in social services. I've worked in state government and the legislature and the city of Minneapolis, but my love is always in social services. So I've worked with babies with the March of Dimes. I've worked with foster care and adoption. I've worked in adult recovery programs, addiction and sobriety. Mm-hmm. But for the last couple of years, I have found myself all the way from babies and children and adults all the way into seniors. So the continuum for me is kind of complete. And I work in social services. My passion, my love is to work with volunteers and build volunteer programs, because I believe volunteerism is how we connect with people on the ground. But I am a caregiver for my grandmother. My grandfather passed recently, and he had memory issues, and I found myself in that journey with him and kind of honoring his legacy. And so now on Tuesdays, I have dinner with Teta, and we have amazing conversations about life, and she helps me ground me in the work that we do, because that's what we do all day long, is to try to make life better for older adults so that they can shimmer.
That's important.
Mm-hmm.
Recently, I was watching an interview with the Secretary of HUD currently, and she was saying that the most unhoused population are young moms and younger kids, as well as older Black women.
Mm-hmm. It is a tragedy to figure out and realize what our data tells us. But we know that, you've lived this life, you're going through the world, and then you get to these golden years, And then poverty hits or it amplifies and we move into homelessness. And it's a tragedy. One of the things the Senior Linkage Line focuses on is trying to find housing options for our older adults. And we have a lot of resources. People call in and, I was just talking with a woman, Miss Barbara, last week, an African-American woman who is caring for her husband who has memory issues. And she said, all I was doing was trying to find some housing options in their area. They lived in North Minneapolis. They finally found a place in Hopkins that could care for, his progression of his issues. But she said, you know what, we found this housing issue, but that wasn't the gem. In the fine print of what you sent us was information on the elderly waiver. And she said, I had no idea what an elderly waiver is. And I said, Miss Barbara, how did that go for you? She goes, well, now we have services coming into the home. Now, because of his memory issues, we have a toothbrush. And you think, it's a toothbrush. It's an electric toothbrush that turns off, that tells him when it's time to stop and start brushing the teeth. He has a scooter that is all electric, and so right now she doesn't pay, because of the elderly waiver, she doesn't pay a Medicare premium. So her life is different because of that. But we know that there's thousands and thousands of folks out there who've never heard of the Senior Linkage Line, who are suffering, and our hope is to get the message out there that they can make the call. And government can't solve all problems, but we can open doors to resources. And that's one of the best gifts of the Senior Linkage Line is we have resources and referrals throughout the state, and we do zip sorts. We might take, 55417, down in South Minneapolis. We might look at that and figure out where those resources are for transportation or chores or delivered meals that really impact people's lives.
Really sounds like it's providing an overall better quality of life for caregivers and their family members that they're supporting. Yeah. Can you talk about what kind of people are calling the Senior Linkage Line? Well,
one of the questions we get all the time is there an age limit? Because it's the Senior Linkage Line. And we've had folks in their 20s and 30s and 50s and 70s calling. So whether they're calling for themselves to unlock the keys to whatever the mystery is they're fixing that day. Maybe it's my brother who's calling on behalf of, a grandparent. Anyone who has questions, who has, desire in their heart to figure out the problem, because there's so many problems that our seniors are facing, and so it doesn't matter. It doesn't matter the age of the individual or the professional or the degrees or non-degrees behind their names. We love that folks call and just say, I don't even know what question to ask, but this is the problem. I'm dealing with poverty. I'm dealing with homelessness. I'm dealing with, nutrition on behalf of a colleague of mine. So we welcome all folks to call. And, I was talking to a woman this morning and she said, sometimes it's good because I just call and you listen to me, right?
That's very important.
It is. Trellis is designated as the Area Agency on Aging. It's a federal designation that goes down to the state of Minnesota, and then the state gives it to 6 organizations. We just happen to be in the Twin Cities. But what comes with that is designation of dollars. Last year, $13.6 million streamed from the feds down to the state, and we don't provide the service. We put it in the hands of 69 nonprofit organizations. They were able to impact people's lives. People call for transportation issues. 22,000 rides were given last year alone to seniors who didn't have transportation. Over 1 million meals were delivered during that time of COVID when we were still very, very nervous about life, and they needed either just a normal meal or a culturally appropriate meal to make sure that their nutrition was met. But the thing you were talking about that really touched my heart is we were able to make telephone reassurance calls. We made over 8,500 calls because people are alone, right? And when our bubble of COVID, right, we might have been calling our grandparents, but a lot of those individuals were absolutely alone on their own, maybe scared to death in their apartment. And these organizations that we gave the monies to, they made telephone. They would say, hey, Anna, how you doing? How is life today? And just have that brief conversation so that people knew that they weren't isolated, and I attended a conference a couple weeks ago on dementia, and one of the speakers, it just blew my mind, said that an individual who was an older person, if they're continually isolated in their world, like we were, right, during the last couple of years, the impact on the longevity of their life can be decreased by 15 years. And we spent the 2 years, right? And some people are still isolating because of natural, issues. But 15 years based on the fact that we're not having the opportunity to have a face-to-face conversation or breaking bread with someone at a meal. There's a lot of challenges out in the world that we're trying to get after, but things like making a simple telephone call, every week, every couple weeks, is impacting someone's life, their quality of their life.
Now, you've talked a little bit about some of the services you all offer. Can you talk a little more in depth about some of those services, as well as maybe one that you haven't mentioned earlier?
The dollars that we receive, we put it in the hands of these organizations. And sometimes, my grandmother, for instance, she's a clean freak. This woman wants her apartment really nice, right? But it's hard. She's 86 years old, and I have caught this woman on a chair dusting. And I'm like, Tata, you gotta stop doing that, girl. And so there's groups that come in, and we can pull lists of people can do light yard work if they happen to live in their homes, or they can come in and do vacuuming or dusting, so that you can not stand on a chair and prevent that fall that is totally going to happen. Yeah. So Chore Services is out there. They have different programs related to nutrition. One of the key things that we work with is special access, and it's kind of a funky little term. And we have a lot of individuals in pockets throughout the Twin Cities where language is a barrier, right? My grandmother's first language is not English, right? It is Arabic. Okay. And so she's isolated a little bit in the world. So we go into different communities where Spanish may be the first language, or Hmong may be the language, or Afana Romo might be that language. And we provide special access, and we pay through these contracts, through these partnerships, individuals. Because can you imagine, you get in the mail, your English is not your first language, you're kind of isolated, and your adult children might be at work, your grandchildren might be at school, and this bill comes or whatnot. They have no idea how to read it. And so special access is us opening up some dollars for folks who speak Afana Romo and English, or Somali and English, or whatever the language is, so that they can come and they can wave this bill in front of them and to say, it's okay, it's not important. They're just telling you this, or, oh, this is important, you need to pay this bill, or you need to tap into different things, or we need to make this telephone call together. And it may be related to medical, it may be related to health insurance, it may be related to assistance from a telephone company. I've actually witnessed a couple of those calls, and it's hard, when that isn't your first language. So those are some of the things, but we happen to be wandering on Medicare open enrollment right now, and one of the things that Trellis does really well, and the Senior Linkage line is quite known for, is assistance with Medicare. I always think this is the kickoff of Medicare open enrollment. I think it's a national holiday, right? I think we should have cake.
I was just about to say, I don't know if anybody else is paying attention, but this is a very important date to acknowledge, because so many people wait.
They wait
to find out about what they can do, or if there's a service that's being offered to them. This is your opportunity to sign up.
And so many people, they don't take the opportunity, because you've got a continuum of people who get, the material comes from their health insurance, and they're on it, they read it, they study it, they've got that brain, right?
True.
And they do their cost comparisons. And then you kind of move through the continuum onto the people who I would say are more like me, like, I can spell Medicare, thank you very much, and I am panicked about the fact that I might have to make a decision. Right. And then all the people in between. What Trellis can do is we have 30 volunteers throughout the metro area, and they can pull in either on a phone call to go over, and you would bring your Medicare card to the table, you'd bring a list of your medications and kind of your lifestyle. Do you like to travel to a warm location during the Minnesota winter? Do you like to stay here? Do you have a pharmacist that you like? Do you have a provider that you've got to have in your network? And we can either do it on the phone or one of 30 different locations throughout the Twin Cities. And folks who are a little more hesitant, they can just say, hey, I need a little bit of help. What we found is that traditionally communities of color do not do this. They do not cost compare Medicare. And I was talking to one of our staff, they were meeting with a couple, just a generic example. They always had the same plan. They always had the same pharmacy, Part D. So they had Part A, Part B, Part D. Everything was the same, and they were married, right? They wanted to be this little couple. So they sat down with one of our counselors named Chris, and Chris said, have you ever thought about the same plan? And they had to have that plan, whatever that plan was. And that's fine. Have you ever thought about separating it? And you take Plan A and you take Plan B, or whatever they called it. because every company has their own names. And so they broke them apart and did a cost comparison of it. And then they looked at the Part D, which is your prescription drug part, and they were able to tweak it because his medical needs were far outweighing hers. And so they split them. This family saved over $100 a month simply by using the same plan but separating it. And so they had $1,400 at the end of the year, and the family said, we have grandkids. I have grandkids the state over, and I want to visit them because Chris was so excited. She's like, "What are you going to do with that money?" They are going to visit their grandkids, and during this time when it's just now to the point of COVID, feeling a little bit better. That's how they can touch their lives. And so, if I could give one message to the community is don't be afraid. Even if you can just spell Medicare, that's okay. Let us have an opportunity to dial in, and our website, folks can go on trellisconnects.org. There's a cute little tab called Get Help. How easy is that? You can listen to information on an educational presentation, so you can kind of do it in the comfort of your home or on your phone. No one's watching you.
At your own pace.
Exactly. You can re-listen to it again, or you can go to a community site like a library or another community center, or you can sign up for an appointment. And I've known a number of people, they have one and they're so confused about it that they sit down and then we pull the information. We might mail it to them, or we might email the information, whatever their preference is for getting information. And then they look at it and then they schedule another appointment. But the key is it's October 15th to December 7th. And when that period ends, for most people on Medicare, that's where we have that opportunity to make a second choice. And next year we can do the same thing. And the year after we can do the same thing, because it's important to know that the premiums change from year to year. Your deductibles change from year to year. Your providers may change, your network coverage, your pharmacy. And so some people, for me, I know I have a relative and he's like, well, my wife has that plan. My brother has that plan. This person. And I'm like, I don't think that's a good enough answer.
Right.
Because it's your money. And if we can encourage people at the end of go through the process and think, the plan that I had last year still works for me, then that's a win, right? But they may go through the process and find something that they may choose to pay a higher premium and a lower deductible, or they may have, macular degeneration and they have to see this specialist. So they want to file that person through the system, and they may decide to pay a little bit more to get this person, or they may be in a situation of, I'm on fixed income. I have got to have the lowest premium available. I'll deal with the deductible when it comes. So it's like a game, right? You've got to figure out where all the pieces. And if you ever want any help, Trellis has, a lot of people on the phone taking phone calls all day long from 8 to 4:30. But we have these volunteers that a lot of them are retired and they never wanted to give up the game. Some of them never did this as their occupation. Mm-hmm. Some of them just said, I don't want my brain to go go south. Right. I want it to stay sharp. So we have a lot of folks that can just help if folks would be willing and brave enough to make that call.
Now, you all have an event coming up November 5th. Can you talk about this special event?
Yeah. It is designed to help people break the scary factor of looking at Medicare. So it's called Let's Talk Medicare. We are at Fellowship Missionary Baptist Church in North Minneapolis. We are bringing in Shaletta Brunlich, who's a really popular radio personality. She is a podcaster. She's a Black influencer. And she used the senior linkage line for her father-in-law. And he, before he passed, bless his soul, he was having a lot of struggles. And she used the resources of the senior linkage line to open some things up. This event on Saturday, it's a 10:30 to noon. We are bringing in individuals from the community to talk about how the senior linkage line helped their lives and how it changed things for the people that they cared about, whether it was themselves or whether it was someone they work with. Shaletta's going to kind of tell the story of her family. And we're just going to have an opportunity to have a very brief time as a group in the sanctuary to talk about Medicare and how to de-scarify it. I think that's a word.
I think we should submit that to Webster's Dictionary.
That's right
to be
there.
Considered. Because that made perfect sense when I just heard it.
But we'll do that. And then the neat thing is that I am contracting with a woman from the church. She's a member of the choir. She is a caterer. And it's called Joyful Temptations Southern Cooking.
Okay.
And most importantly, her grandson told me she's the best cook ever. So I'm gonna go with grandson there. But we're gonna have a meal, right? She's gonna bring in this beautiful meal. We're gonna have an opportunity to talk at tables. If people are nervous in a big group, in a congregation, maybe of 100 people, we're going to go table to table and have 6 here and 6 here, and then I'm going to put one of our volunteers at every table so that folks can ask those questions. And again, what we know is that mainstream white community, they cost compare and they save money. What we know about communities of color and communities that are struggling income-wise, they don't trust and they don't know. And so we're trying to open up the banquet hall and open the table wide so that folks can feel like, I can do this. So we'll have opportunities for have conversations with Shaletta. She's going to actually do her radio broadcast from the show. You
guys are going to have a live telecast.
Yes,
That's going to be wonderful.
Yeah. So we're trying to, it was intentionally placed in North Minneapolis because we know that our brothers and sisters, our individuals there, have never really asked for help because they never felt welcome at the table. And my hope intentionally is to say, you know what? You need to save money too. And again, it's not always about saving money. It's about finding the right plan for you. And so our hope is to bring in the community and have them ask tough questions and then put them with experts at lunch to be able to answer those questions.
I think it's powerful to not only have this conversation at Fellowship, which is one of the cornerstone churches over North Minneapolis and within the Twin Cities, which also has a very high senior population. So hopefully a lot of the viewers, but also people that are around the surrounding communities will come out and attend this event. However, I think it's very important to have this conversation with Shaletta being there and giving her own personal witness of what took place and the support she received, but also to doing the table idea. I think that's really important to sit around and hear other people raise issues or concerns that they have, and then to have someone else probably further down the table to say, me too, I actually was wondering about that. And then to hear what the solution is, or is there a cheaper option for me? Yeah. Especially when we're looking at seniors who are, a lot of them, looking at fixed incomes and trying to consider, how am I going to afford the life that I currently have in tandem with all my medical expenses?
Yeah. And you will have some experts in the field, and we listen for things and keywords that come up. And like I talked about Miss Barbara earlier, she didn't know she was eligible for an elderly waiver. And right now she went from, a couple $100s a month on a premium down to $0. And that's not for everyone, but we listened to her and we heard things related to income and assets and went, why are you not on this program? And so opened up that door. And, my mama always said, we care about people we break bread with. You mentioned the lunch factor. We could have certainly had a workshop and been gone. But I think it's important to sit down in a more relaxed environment and let people talk and listen to them so that they can tell their story, they can share their reality, they can give their testimony. But also, if they have criticisms, right? I don't think we shy away from that, because some days government does a great job and sometimes we don't. So I think it's an opportunity for us to say, okay, how do we do better? How can we improve the life? Or maybe the resource isn't there. But maybe we need to go deeper. I was in community a couple weeks ago with a group of Afan Oromo speaking gentlemen, and we spoke through translation, and they were really frustrated about something related to the county. And I said, well, I have a little bit of privilege sitting right here, called up a person that I knew, gonna sit down, we're setting up a meeting so they can air their grievances. I think a thing like November 5th, the Let's Talk Medicare, is an opportunity for folks to come and say, this is the problems that I'm having, and us to be in real time with experts at the table who will be from government to see what can we do, what can we do to fix your problem so that at the end of the day you're feeling better about it. Or if there's nothing to be fixed, can we open up another door for resources? Or are there other assistance programs that we can put in play? And maybe at the end of the day people say, I picked the right program, right? That's the right one for me. And now I have confidence to know that I did the right thing. And again, we'll do it again next year. Every year programs change, plans change, and we want to empower people to make good decisions for themselves. So I'm excited that we wanted to talk about that today, because it's a really, we've never done it before. So I'm into trying new things and seeing where we meet people in their neighborhood, as opposed to them coming to us. We want to come to their backyards.
I think this partnership is going to be really fruitful for both of you guys.
Yeah.
Now, you've talked a little bit about volunteerism. Can you share about the importance of that and how it really amplifies your organization?
That is my favorite topic to talk about, hands down. I have been working in the field of volunteer management for 10, 15 years. I have built different programs from the ground up. And I tell you, There's nothing more important in our world in terms of feeling value in the world as it is to volunteer, right? I mean, a lot of people benefit from the recipient side of a food program or a dog animal rescue piece. But for me, it's the altruism of knowing that I have done something to someone else's life. I've touched them in an authentic, beautiful, kind way. In Trellis, we have about 90 volunteers, and they do things from and administrative. They come in and they do paperwork for us. Mm-hmm. We have individuals that do marketing for us. We have individuals that do Medicare counseling, right? They go out, their brains are incredibly left brain, right? We have individuals that do public speaking, and they help us with things. We just trying to figure out how to bring on a photographer as a volunteer role. And what it does is, we have volunteers in our organization who are 22 years old, they're in grad school, and they are giving back, which is an incredible testament, I think, to their families and where they were brought up. But I have a guy in my organization, his name is John. He goes, I'm an octogenarian, which means he's 80. And he is still doing Medicare. He is still bringing it every week to the table. So volunteers for me are, it's like one of the greatest sources of joy in my life to know that we're opening opportunities for people to stay busy in retirement, stay busy in their life, give back, and feel like they've authentically improved someone's life. So again, volunteerism, I could talk about it all day.
I appreciate you coming and not only sharing the resources, but also highlighting this amazing event. What I'm going to ask you to do now is provide us with any social media handles and or web addresses that you all have, so that people that are watching this and want to stay connected or want to read about the upcoming event can actually participate.
Perfect. Well, our website is pretty easy to access. It's trellisconnects.org. So the word trellisconnects.org. On that, if you want to find more about the event, there's a tab called Updates. It goes right to Miss Shaletta's event. We called it the Miss Shaletta event because
I was going to say
it's Shaletta Brothers.
She's pretty much the big deal.
That's right. She is a big deal. So you can go to that tab to find out about the event, and you can register for a live stream as well as the in-person. And that's the key is some people are still hesitant about COVID. Totally fine, or they don't have transportation, that's fine. They can watch it live, but you don't get lunch if you don't go to the live event. So, you make your choices there. Also, the hashtag for us is Trellis Connects, both on Facebook and on LinkedIn. But on our website, there's a tab called Get Help. And you can find, like I said, an education presentation, or it says Medicare. You can watch videos on Medicare. You can watch videos related to healthcare directives, fall prevention, senior linkage line from the comfort of your home in your fuzzy slippers where no one's judging you. So,
that's my favorite way to enjoy it.
I know it, right?
I don't have to wear shoes? Sure. Count me in.
That's good. But trellisconnects.org is the place to start.
Wonderful. Can you please look in this camera for me and provide just a word of encouragement or advice to someone that is hesitant on calling and connecting with you all?
You know what? My team is so loving and caring and professional. I would say give us a call. It's a 1-800-333-2433. You can do it from the anonymity of your home anytime between Monday and Friday, 8 to 4:30. Make the call. Now, it's open enrollment, so it's a little busier right now, so you're going to be prepared for a 2 or 3 minute delay. But if you can have any question, if you're hesitant about calling, you don't know us, we don't know you, but we would love to listen and make things a little bit easier for your life. So I would say if you've got a couple minutes free, it's worth the gamble. Again, Ms. Barbara is now paying $0 in Medicare premiums because she just stumbled on a program that helped, or maybe it's assistance for the winter that's coming up. We can apply for different programs that way. So my team is, just in Trellis, so there's 6 organizations around the state, and I have worked in social services, again, from babies to addiction to foster care, and I have never worked in a place where people really cared as much. And I say that very authentically and genuinely. So give us a shot, give us a call, and if you work it as a professional, you can give us a call too. We would love to hear from you.
Thank you for joining me today. I am so excited to have shared this time with you and to be able to share the resources that you and the wonderful work of Trellis are promoting at this time.
Appreciate it. Appreciate the time.
That is all the time that we have for today. A special thank you to the wonderful people over at Trellis, as well as Jetta, who is our guest today, and her wonderful team. I hope something was said today that you have found inspirational, educational, or resourceful. Please check out the website that she provided as well as the social media handles given so that you can stay connected if you are someone seeking assistance in supporting the elder in your care. As always, I've been Anna Orr, and I look forward to connecting again with you soon. Thank you.